Hi, my name is Christina Anderson, and I'm doing my physical assessment for MSN 610. I'm washing my hands. Hi, my name is Christina. I'm a nurse practitioner student at Northern Kentucky University, and your name is?
Roy Sullivan.
Can you tell me why you're here?
For a physical assessment.
What's your date of birth?
June 9th, 1964.
What's today's date?
May 5th, 2019.
And where are you?
Pikeville, Kentucky.
And who's the president?
Donald Trump.
I asked Mr. Sullivan these questions to see if he is alert and oriented he has no delay in recall by asking these questions, and he is alert and oriented ×4, person, place, time, and situation. Before we started the video, we did perform his vital signs. His blood pressure was 126/70, pulse 72, respiration 16, temperature was 98.4. We also performed an eye exam on him, and his visual acuity was 20/20, which tested cranial nerve number 2. Mr. Sullivan, is it okay if I palpate your scalp?
Yes.
What I'm doing is I'm looking to see if there's any infestation, see if there's normal hair distribution, see if his scalp is not dry or scaly, if there's any places or lesions on his scalp. His scalp seems to be normal. Mr. Sullivan, is it okay if I press on your sinuses?
Yes.
I'm going to check his frontal and his maxillary sinuses to see if there's any pain. Is there any pain, Mr. Sullivan?
No. No.
Okay. Have you been having any pain out of your sinuses?
No.
Okay. Now I'm going to press in on your TMJ, and will you open your mouth for me? Close it, open, close it, move it side to side. Is there any pain there?
No.
Okay. Now can you open your mouth with resistance? Okay. Now I'm going to check. I want you to follow the pin light with just your eyes. This checks cranial nerve number 2, 3, and 6. His eye movements are normal. Okay. Now I'm going to look at the sclera and conjunctiva. It's pink and white. It's moist. Looks like he has healthy eyes. Now I'm going to check the reflex in his eyes, the light. Open, please. Okay. Okay, his pupils are equal and reactive to light. Now I'm going to whisper some words, and I want you to tell me what the word is.
Basketball. Baseball.
Okay. Now I'm going to take this tuning fork, and I'm going to put it top of your head. You tell me when you hear, if you could hear it, and when it stops. And then I'm going to put it behind your ear and in front of your ear, okay?
Okay. I hear it. Stop. I hear it.
Is it louder in front or in back of your ear? Is it different at all?
It's louder in front.
Okay.
I hear it. Hear it.
Okay. Louder in the front or the back, or the same?
Louder in the front.
Okay. Now I'm going to look at your ears. His pinna looks good. It's pink. It's symmetrical. I'm going to look inside your ears, Mr. Sullivan.
Okay.
He has a gray, shiny tympanic membrane. appears to be no fluid inside their ear. Gray tympanic brain. Okay, I'm going to cover one of your nasal passages, and I want you to breathe in. You have any problem breathing?
No.
Any pain?
No.
Okay, your other side? Any pain or problems breathing?
No.
Okay. I'm going to look up your nose. Okay. His nasal septum is midline. There's no deviations. Now I want you to stick out your tongue. Say ah.
Ah.
Okay. Hold on, let me get my tongue depressor. Okay, I'm going to check in there. Stick out your tongue. Ah.
Ah.
Okay, let me check inside. See if there's any dental caries. There's no dental caries. Buccal membranes look good. They're pink and moist. Raise up your tongue, please. You look underneath the tongue because that is usually signs for, that's where mouth cancer starts. That's checking also cranial nerve number 9, 10, and 12. Now, I want you to push my hand with your head. There you go. There you go. I want you to shrug your shoulders. Shrug your shoulders, okay? Up and down. It's cranial nerve number 11. I need to look at his neck. His trachea is midline. I've had his thyroid. It's not enlarged. Oh, also with your eyes, Mr. Sullivan, when you look in the pin light and watch it till it goes in. Okay. No convergence. Now I'm going to palpate his. Mr. Sullivan, I need you to put your chin against your neck, please. Up and down. Put your ear to your shoulder. Ear to the other shoulder. And look side to side, please. It's cranial nerve number 11. Now I'm going to check your lymph nodes, which is the preauricular, postauricular, submental, submandibular, jugular gastric, superficial clavicular, deep cervical chain, posterior cervical, occipital, and supraclavicular. Now I'm going to fit your carotid pulse. It's strong, +2. On the other side. I'm going to listen to your carotid pulse with my stethoscope, with the bell of my stethoscope. The other side. to lay back for me. Extend your neck, turn it to the side. I'm looking for jugular vein distension. I need you to look the other side. There you go. There's no distension of his jugular vein. All right, lay right there, Mr. Sullivan. We'll listen to his heart sounds. Palpate for the point of maximum, his PMI. Now I'm going to listen to his heart sounds. His aortic, pulmonic, tricuspid, mitral, his heart sounds has S1 and S2 and it's regular rhythm with no, he has no murmurs. I'm going to also listen to his apical pulse, which is at the fifth intercostal space. Heart rate 70. Now, Mr. Sullivan, I'm going to palpate your abdomen. Is it okay if I push in on your abdomen?
Yes.
Have you been having any pain or anything like that with your abdomen? Any tenderness?
No.
His abdomen is symmetrical. It's rounded. I'm going to do light palpation. Okay, and then some deep. See if we can feel the edges of the liver and the spleen. Okay. Now I'm going to listen for his vascular, his aorta, and renal arteries. What you're listening for, you don't want to hear a bruit. And now I'm going to listen to his abdominal sounds, starting with the right lower quadrant. He has active bowel sounds. Okay, Mr. Sullivan, you can sit up, please. I'm going to look at your back. Listen to your lungs. While I'm doing this, while I'm looking at his back, I'm seeing if everything's midline. Looking at his skin, seeing if there's any moles that look suspicious. Skin looks good. There's no lesions, no bumps. When you feel me move the stethoscope, take a couple of deep breaths through your mouth, please. Okay, on the left, we know that there's 2 lobes. And on the right, there's 3. Okay. Breath sounds are normal, no rhonchi, no crackles, no wheezing. Can you lay back down for me, Mr. Sullivan? I'm going to look at his lower extremities, check his capillary refill, check his legs. He has normal hair distribution on his legs. His capillary refill on his toes is quick. There's no ridges, there's no clubbing. His nail beds are pink. Skin is dry and warm. Okay, I need you to push, pull. Okay, I need you to lift one leg up, hold it for 10 seconds. 10, 9, 8, 7. Okay, pull it out and back in. And you put it down. Other 1, 2. Okay, out and back in and down. Okay. Now I want you to raise your knee as far as you can up to your. Okay, is there any pain there?
No.
Okay, and down and up and down. Now when you see the range of motion of your ankles, can you roll them for me? Okay, how about the other one? Okay, good job. Okay, I'm going to check your reflexes. This is the Babinski's reflex. Either your toes will curl forward or an adult will pull their foot back because it tickles. Okay, can you sit back up, Mr. Sullivan? Can you lay back? Okay, I'm going to feel your femoral pulses. Okay, I'm going to raise up your shorts. Okay. Now when you raise your arms up, I'm going to feel your lymph nodes under your arm. This may tickle. Okay, another one. Okay. I needed you to check your reflexes on the arms. Okay. And here. Okay. Okay. Now, can you scoot back and I'll try to crush your leg. Okay. Alrighty. Check your brachial. Put your leg up, please. Okay. Alright. Now I'm going to check your brachial pulses. Popliteal. Okay. Now can you stand for me? Okay. We're almost finished. I need you to walk to the chair, to the couch and back for me, please. And walk back, heel to toe. Okay. Now I need you to close your eyes. Just stand there. There's no swaying. This is Romberg test. All right, now I'm going to point my finger. I want you to point your finger to your nose and to my finger as fast as you can. Okay, close your eyes. Okay, good job. Now I need to take your heel to your shin and raise it up. Other one, please. Okay. Now I need you to twist your spine. Okay, from the waist, all right. I need you to turn around. Is there any tenderness in your back?
No.
Need you to bend over. Okay, spine is midline. There's no curve. That's good. Okay, can you raise up? Sullivan, I think that we're finished. Do you have any questions?
No, thank you.
Thank you. Also, Mr. Sullivan, thank you. This is the end of the video. We would perform a breast exam and a rectal, digital rectal exam and a testicular exam if it was in a normal clinical setting. Thank you.